What's up, guys? Hope you guys have had an awesome day. There is Innovative Dental right now, right behind me. See it? It's leaving. Anyways, wanted to point that out because this is the first ever, I don't know, I came up with this cheesy idea of doing videos on the road called the Dental Drive. We'll see if it works out. But the idea is that I get a lot of questions and a lot of thoughts that people have about dentistry and wanted to address those that, man, it's just tough finding time, really. So I figured, hey, I've got 15 minutes driving home. I can answer a few questions. It might be helpful to some people. Some people might think it's a waste of time, but hey, maybe it'll help some people with their dental questions. So post them. If it's a question I think I can answer in text, I definitely will, but obviously if there's a video and I think it might impact a lot of people, like this question was. This one is from, let's see if I can get it's gonna be a little tricky. It says, doctor, I need help with, I had a cyst removed, and basically the cyst had a root canal because of that cyst, caused my tooth to get dark, and they were just saying that they're trying to figure out what to do with this front tooth that's dark. So I think that's a common question, like, hey, I got one dark tooth from a root canal, what do I do? And it really depends on which tooth, it depends on how dark, but I would say that if it is one of your front two teeth, one thing you really want to consider is having the one that is the most dark, have a crown done on it, or if it's a root canal, probably, and if it's just dark from stain, maybe a veneer. But I always recommend symmetry, and so what I mean by that is, hey, if you're gonna veneer one, you should probably crown or veneer the other, the front two at least. That way, over time, when one of the teeth stains and gets a different color, you don't have to worry about them not looking the exact same. And porcelain, as you can see in one of the videos that we've done, doesn't stain. So I'd recommend that. There's a couple different materials that'll help block out a dark tooth but still look natural. I'd steer clear of any material that looks chalky, which one of those is porcelain fused to metal. Not too many dentists are using that anymore. Another one that somehow is like this fetish that dentists have, and I know I'm gonna get some flack, but I'm just being real. It's with this material called zirconia. It's super opaque. You can't see through it. It's very abrasive to the opposing teeth. If you've ever seen it wear against opposing teeth, it's bad. So I don't like it, but I see a lot of people use that to block out dark teeth. It's also can be made very thin, and it's super strong. But there's other materials out there that are really strong enough. They look great, and don't have all the downsides of the way they wear against other teeth. So, by the way, Dexter's back there too. Dexter, you want to wave at everybody on YouTube? No? Anyways. But so anyways, that's the first episode of the Daily Drive. Thought I'd give a little insight on how to treat or handle a dark front tooth. I've got some examples, and obviously down the road I'll be able to maybe do that. But between family, running a dental practice, taking care of things there, and just trying to do these videos, I probably spend like I don't have anybody produce the videos. I do them all myself. So like 5 to 7 hours of working on them. Pretty time-consuming stuff, so I can't do probably more than 1 or 2 a week or so, and still be able to keep up with the important things like my family and making sure that our patients get the best. But lots of good stuff to talk about down the road. I know we've got some exciting things that I can't wait to drive and talk about. So hopefully you enjoyed this first episode of the Dental Drive. And you know what? You guys have an awesome day. Hopefully you already had an awesome day, but maybe you're still, I don't know, time zone, right? But have a great day, and look forward to catching you in the next episode of whatever it is. Anyways, talk to you soon. Bye.